Hello, I'm Barbara Sarah. You're watching Al Jazeera live from London. Also coming up, the coronavirus death toll passes 50,000 in Europe, but the number of fatalities across the continent seems to be falling. Empty streets and closed shops. The pandemic forces the Democratic Republic of Congo to shut down its main commercial hub in the capital, Kinshasa. And staying connected in Chile, we look at some of the creative ways that people are using to socialize and keep in shape under lockdown. We begin the programme with breaking news that the British Prime Minister Boris Johnson has been moved to intensive care inside a London hospital after his COVID-19 symptoms worsened. Johnson was admitted to hospital on Sunday night and had been undergoing tests after suffering persistent symptoms for more than 10 days. Earlier on Monday, the government had said Boris Johnson was in good spirits and still in charge. But Downing Street now says Foreign Secretary Dominic Raab has been asked to deputise. Nadeem Baba joins me now live from London via Skype. And Nadeem, I think it was only a few days ago, I think Thursday evening, when we saw some images of the Prime Minister. He stepped outside briefly to applaud workers of the National Health System. That was Thursday. It's now Monday, and it seems an incredibly quick deterioration. What else do we know?
That's right, Barbara. When he did appear in Downing Street on Thursday evening for that applause for health and care workers, he didn't look a well man at all. Lots of people commented on that. But it's not a surprising development for somebody who has coronavirus, who has COVID-19, as he did, and went into isolation over 10 days ago, for things to change fairly quickly. I mean, in terms of a number of days, that's not a surprising development that he was admitted to St Thomas's Hospital on the south bank of the River Thames on Sunday evening local time. We were told that was for as a precautionary step, and he'd be receiving routine checks. It's understood that those checks partly are to do with any breathing difficulties, and that was also because he was still suffering symptoms of COVID-19, including a high temperature and a persistent cough. One of the well-known symptoms is a dry cough. Now, on Monday, of course, he didn't chair the cabinet meeting for the first time since he was in isolation. He'd been doing it via video link. Dominic Raab, the Foreign Secretary, did. Then Mr. Raab appeared at this press briefing just a few hours ago now, saying that Boris Johnson was in good spirits. And in fact, Boris Johnson himself had tweeted as much, that he was fine, basically. And Mr. Raab said, under repeated questioning from reporters who were questioning why Boris Johnson was continuing to work if he was unwell enough to be in hospital, Mr. Raab said he continues to take advice from his doctors, but that he continues to run things, he continues to head the government and to receive regular updates. Well, now this surprise news that at about 7 p.m. local time, just a couple of hours ago, from 10 Downing Street themselves, saying that he was moved to the intensive care unit in that hospital in case he needed a ventilator. Now, the local press are also reporting a bit more detail, saying that, in fact, in the course of the afternoon, he started to experience breathing difficulties and had to be administered oxygen. That doesn't mean he was using a ventilator, but it does mean that it had become more serious. That much is clear, Barbara.
And obviously there's a lot that we don't know right now, Nadeem, but from what we do understand, it doesn't seem that he's been intubated quite yet. Nadeem, can you hear me? I think we've lost the connection to Nadeem Baba joining us from London. Well, Nadeem, thank you for that. And of course, we'll bring you more developments on the condition of Boris Johnson, the British Prime Minister, who has been taken to intensive care a few hours ago. Now the news broke in the past half hour or so, and we will bring you more developments as we get them here in the newsroom. Meanwhile, the coronavirus death toll in Europe has now passed 50,000. 700,000 people have been infected, but there are signs that the rate could be leveling off. Spain, Germany and the UK recorded their lowest number of deaths in several days. Paul Brennan reports.
Europe passed another significant number on Monday as the continent's death toll from coronavirus exceeded 50,000 people. That's the vast majority of the 70,000 who've died globally so far. But while the infection is still on an upward curve in some European countries, in others there are signs that the contagion is starting to stabilise. Austria hopes to allow small shops and garden centres to reopen on April the 14th, with restrictions potentially lifted on larger shops and hairdressers on May the 1st. But speaking from behind a protective Perspex screen, the Austrian Chancellor warned that everything depends on the infection rate.
The week of Easter will be a deciding week for us. It will be a week which will decide whether the resurrection after Easter, which we are all hoping for, can actually happen as planned.
The Spanish government is also studying how to gradually ease the lockdown it imposed since March 14th. Movement restrictions have left poor and vulnerable residents relying on charitable groups like this one in Seville to bring them food parcels. But on Monday, Spain saw a fourth consecutive day's drop in the number of new deaths, and the number of new infections rising just 3.3% offers some cause for hope. Relaxing the restrictions can't come soon enough for those living beside Lake Constance. The barbed wire, which once separated the German town of Constance and its Swiss neighbour Kreuzlingen, was torn down after World War II, and residents mingled freely ever since. Now a new fence has created a coronavirus no man's land, separating friends, relatives and lovers like Jean-Pierre and his German girlfriend.
We've been speaking to each other on FaceTime in recent weeks, and that's okay for a while. But after 2 or 3 weeks, you realise that that's not good enough. We needed to see each other and hear each other's voice. There was no other way but to meet here at this fence.
In Italy's Lombardy region, despite reductions in both infection and death rates, authorities have actually tightened restrictions, and residents now have to cover their mouth and nose whenever they go outside. It's an order intended to prevent complacency, but a shortage of face masks is creating a problem.
We cannot find protective masks. I haven't found them, so I made one myself. Authorities say masks will be available in 3 days, but they've been saying that for a month.
Restrictive measures are having an impact on the spread of the virus, and collective discipline and a sense of civic duty are helping to save lives.
Adiós, campeona!
And more people, like this woman leaving intensive care, are surviving. But there are many thousands who will not make it to this stage of recovery. And avoiding infection in the first place still remains the safest strategy. Paul Brennan, Al Jazeera.
Well, it's good news in France. It recorded its highest number of deaths in a 24-hour period since the outbreak began. Another 833 people have been confirmed dead, taking the total number of fatalities to nearly 9,000. French Health Minister Olivier Véran warned the country has not yet reached the peak of its outbreak. Well, Gloria Tagliani is a member of the task force of the Italian Civil Protection Department working in northern Italy. She says the effects of social distancing are being seen, but deaths will remain high for some time.
Well, the number of deaths usually tell us what's going on in the time lag between the beginning of the disease and the end of the disease that may determine recovery or death. And since the distance between the 2 points may be as long as 2, 3, 4 weeks, maybe in some patients, of course, when we check the point of death, we should remember that the disease started many weeks before. And therefore, it represents the end of what was going on at that time. The number of deaths will remain at a kind of plateau for a while, even if the number of new cases are going to decline. People now understand that when they go around, they should wear masks. And they do, indeed. Or they should maintain a distance of at least 1 to 2 meters to prevent infection from one to another. the combination of the two awareness makes people be more careful, and the virus spread in a much less intensive way.
New York State Governor Andrew Cuomo says coronavirus cases there may be starting to plateau. But in a briefing on Monday, he warned against complacency and extended a closure of non-essential businesses and schools until the end of April. Andrew Cuomo says hospitalizations have declined, along with admissions to intensive care units, signaling a possible flattening of the curve. More than 4,700 people have died in New York. That's the highest death toll in any American state.
This is an enemy that we have underestimated from day one, and we have paid the price dearly. Well, the numbers look like they may be turning. Yay, it's over. No, it's not. And other places have made that mistake. Hong Kong has made that mistake. South Korea has made that mistake. And we're not going to make that mistake.
Well, Shia Bratansi joins us live now from Washington by Skype. Shia, it's interesting listening to Andrew Cuomo there. He's being incredibly careful about not being too optimistic, about not seeming complacent. What is the situation like in New York? Because looking at the figures, it does seem that potentially the numbers are plateauing.
Plateauing at a very high rate, as Cuomo himself mentioned. About 599 people in New York State died between Sunday and Monday morning. So although that's at a relatively similar level to what we've seen over the last several days in New York, that's still a lot of people, quite obviously. He was also very cautious because I think the reason that there may be some sort of plateau, if that is indeed what we're saying here, is because the social distancing measures are working. So the last thing the governor wants to do is suggest, okay, things are getting back to normal now, we can now relax at all. And as you said, he's extended the closure, the effective closure of the state until the end of the month. So that's the reason for caution. But it is fascinating. I was just looking at the University of Washington model for when different states will reach their peak numbers of deaths, the peak demand for hospital resources. It's one of many models that's been going around, the one that many people have been using, not peer-reviewed or anything, but certainly has been relatively accurate up to this point. And I was just looking up New York State, and it's, according to this model, the peak fatalities was April 9th, peak demand on resources, actually it's the other way around. Peak use of resources, April 9th, peak fatalities, April 10th. So that's this week. So this would suggest it's by and large in keeping with the models that have been out there so that people can allocate resources. And these models are all based on when the states began their social distancing programs. And they also rely on the social distancing continuing until May at least. But it would appear then that the models seem to be relatively accurate, but even if there's a plateau, these are plateaus at very high levels. And as the Surgeon General warned just on Sunday, that this is going to be there's going to be a lot of death this week. It could be comparable to Pearl Harbor, he said.
That's pretty shocking just to hear that. And Shia, there is another White House coronavirus task force briefing in about 45 minutes. What are we expecting to hear from that?
I think still this debate as to why Donald Trump is pushing hydroxychloroquine, the anti-malarial drug that's used for arthritis and lupus, when the clinical trials aren't in yet. And what we now know is the open discord within the White House in the task force, but also used with Peter Navarro, Donald Trump's trade advisor, who's not officially on the task force, the fight that they had on Saturday, the fact that Donald Trump wouldn't let Fauci, Dr. Anthony Fauci, who's seen as one of the most reliable voices in the administration on coronavirus, even speak about the drug on Sunday. We've now had reports from the press, the Washington Post, New York Times, and others, Axios, that Donald Trump is taking advice not just from Anthony Fauci and the medical folks, but from Rudy Giuliani. Obviously, Jared Kushner's involved, and now Peter Navarro, the trade advisor, who seem to be pushing for the use of hydroxychloroquine, even though the clinical studies aren't in. So I think this is the big debate right now: is where is Donald Trump getting his advice from? Is this necessarily the most helpful thing in the midst of the pandemic?
Shia Bratansi with the latest there from Washington, D.C. Shihab, thank you. Still to come here on Al Jazeera, bringing down the barriers. Businesses shut by coronavirus start returning to Wuhan. And how a surge in complaints over profiteering has led to a crackdown on coronavirus scams.
Hello there. Mostly clear conditions across much of Australia. However, we cannot say the same when it comes to this. This is our tropical cyclone, Harold. This is a very intense and powerful tropical cyclone. Now, through Tuesday, the winds are forecast to still be sustained at about 230 kilometres an hour. That would make it a Category 4 system if it was in the Atlantic. It'll continue to work its way throughout to the island chain, the Vanuatu chain, and also on towards Fiji. Now, some very heavy amounts of rain with the storm system, very, very strong winds. There will be flooding and there will be damage. We'll keep a very close eye on it. Now, Tuesday, cloudy skies across much of the southeast of Australia. The showers back in the forecast through Wednesday, pushing up that east coast on towards Sydney. Meanwhile, a few showers along coastal areas across the north and the northwest. Meanwhile, it just stayed very warm in Perth. In fact, I say stays warm. It gets warmer and warmer. By the time we get to Thursday, we're up to 35 Celsius, and that is about 8 degrees above the average for this time of year. No sign of any rain. We've had mixed conditions across the northeast of Asia. We've had mostly clear conditions, though, across northern areas of China. This is Beijing, and you can see here the sky's relatively clear. There's more cloud in the forecast over the next few days. The rain is clearing away from the south. We've got some pretty good conditions across Japan as we go through Tuesday. Wednesday, a few showers, and there's a high in Beijing of just 18.
Russia has jeopardized the United States' security interests.
We know what you are doing, and you will not succeed.
Perceptions from the outside, looking in. But what's the picture from the inside?
I think Russia's foreign policy is too soft.
What Russian goals have we achieved? None.
Peace and War, the view from Russia on Al Jazeera.
Welcome back. Here's a reminder of the top stories on Al Jazeera. The condition of UK Prime Minister Boris Johnson has worsened in the past few hours, and he has been taken to intensive care. The First Secretary of State, Dominic Raab, has been asked to deputise for Johnson where necessary. Meanwhile, the coronavirus death toll in Europe has now passed 50,000. 700,000 people have been infected. But there are signs the rate is levelling off. Spain, Germany and the UK recorded their fewest deaths in several days. And New York Governor Andrew Cuomo says the state healthcare system is at maximum capacity. He says a decline in the number of hospitalizations could suggest a plateauing off of infections. The Democratic Republic of Congo's government has shut down the capital's main commercial hub for 14 days. Kinshasa is the center of the DRC's outbreak. Many of the 12 million people who live in the city will be impacted by the decision because they also work or do business in the district of Gombe. The coronavirus has infected 161 people and killed